I'm Cara Hanson. I am Professor of Health Economics at the London School of Hygiene and Tropical Medicine, and I am a principal acting as a consultant to the project. This research is really exciting for me because this is a great moment for health systems development. I think the whole momentum around universal health coverage is really catalyzing countries to think about how they can make their systems better. And an important part of that is to stop making old mistakes and start making new mistakes. By that I mean making sure that we're not just doing the same thing over and over again, but trying out new things and learning from the experience of others. So one of the main challenges that I've had in this project is really coming to terms with a shift in focus from the what countries can learn from each other, thinking about the generalizability and the transferability of actual policy lessons, to the how countries learn from each other, what sort of processes and activities can support cross-country learning. So one of my favorite moments from working on this project was at our first consultative meeting in London, sitting in a small group discussion and listening to somebody from the Nigerian health system talk about his experience of moving into a position of authority in his ministry and trying to figure out how he was going to solve problems and looking to other states for examples of how he might do that. So I think in a federal system like Nigeria, that learning between states is an important thing as well. We're not just talking about learning between countries. So one experience I've had seeing countries learn from each other has been in Southeast Asia, where I've been really impressed by the way the Thai government, that's really made enormous advances in universal coverage, has been playing a role as a peer and a leader in the region, really bringing their technical and their institutional knowledge to bear and sharing it with others. So they often have teams from Vietnam or from Laos or from Bhutan who come to visit some of their institutions, like the National Health Security Organization or their Health Technology Assessment Organization, to come and learn how they do things in Thailand. If I had to choose 3 words to describe this project, I would say complex, opportunity, and demand. Do I have to explain why? So the project is really quite complex. It has a lot of moving parts, and it does involve this shift in thinking away from what countries should learn to how countries should learn. And it turns out that that's far more complex than I think any of us had thought at the beginning. The second is opportunity. This is a great moment of opportunity for country health systems to learn from each other. There's such a lot of momentum for health system change. And the third is demand. I think we really need to understand more about what the users of this information want, need, what they'll find useful, and what they'll be able to use in practice.